Hi everyone, welcome to my channel Chi-Chi's and Me Chihuahua Reality. Here is where I help you and your Chihuahua live the best life ever together. Here we talk about everything you ever wanted to know about the Chihuahua breed. We talk about Chihuahua health, nutrition, training, and behavior. So if that sounds like something that you would be interested in, then please subscribe and don't forget to click the bell down below there somewhere. Click the bell so that you will be notified of any future videos that I upload. And I will be uploading more videos soon, so please subscribe. If you want to know what qualifies me to help you with your Chihuahua, I've put a link in below that takes you to my About page, and you can read all about me and my Chihuahuas. But before we get started on this video, there's a couple of things that I would like to say to you. Number one, I thank you all so much for being so patient and waiting and waiting and waiting for the next video. I thank you for all the wonderful comments, the positive feedback that I have gotten here on this channel, and it has definitely been encouraging, and I thank you all so very much. You know, on my blog, I have talked and I've written articles, many articles about the importance of dental health for dogs, any dog, but especially Chihuahuas. And you know why that is? Because as long as they haven't lost any, or maybe some didn't grow in, but generally adult Chihuahuas have the same number of teeth as any other dog breed. That's 42 teeth. But with Chihuahuas, they're all crammed into this tiny little mouth, which makes a great breeding ground for bacteria, plaque, and tartar. And that is why Chihuahuas are notorious for having teeth problems. You all have met my Winston. We adopted him in December of 2020, and he already had teeth pulled to the point where his canine teeth had to be pulled, and so he isn't able to hold his tongue in. How many Chihuahuas have you seen with their tongue hanging out? And that is the reason for it, because they've lost their teeth that hold their tongue in. I don't want that to happen to Cora. I know you don't want that to happen to your Chihuahua. Have you ever been concerned about getting your dog, your Chihuahua, a professional dental cleaning? Have people told you Chihuahuas are just too tiny to go under anesthesia? I've heard it many times. Or if your dog, your Chihuahua, was in an accident, God forbid, or something like that, and you had to take them to the vet and they rush them to the back. Does that worry you? Do you wonder what goes on back there? And are they being kind? Are they being gentle? Are they taking good care of your Chihuahua? All of these things, I think we've all wondered at one time or another. Sometimes we as Chihuahua owners, and we love our pets so much that it's scarier for us than it is for them. So come along with us today, because today is a big day. She's having a hard time sitting still. Today is a big day for Miss Cora. She is going to go in for a dental cleaning today, and you are invited to go along with me. The veterinarian where I take all my dogs, I've gone to them for over 35 years for all my pets and my Chihuahuas. And the place where I go, and I used to work there part-time, they have kindly agreed to let me go in with Cora and to record part of the procedure just for you, and you're invited to go along with us. Isn't that exciting? Cora, is that exciting? Are you excited? She just can't wait, as you can tell. We're leaving pretty soon, and we'll see you later. Say bye. Say see you later. Okay, here we are in the car. Say hi, Cora. Say hi. She doesn't look nervous at all, does she? No, she's a good girl. Okay, so we're in the car and we're getting ready to leave to go to the vet. Keep in mind, I am not a professional videographer, so I'm hoping that this all goes well. So are you ready? We're supposed to get there, park on the north side, go in the north door, which is not the front door, and find Trevor. I used to work with Trevor. I love Trevor. So we're going to look for Trevor, and then he will take us back or do whatever Dr. Herod has planned for us. So here we go. Are you ready? Let's get it done. Okay, we have arrived. And just like any human medical procedure, Cora has had nothing to eat or drink since midnight. Actually, she hasn't had anything to eat or drink since right before we went to bed last night, which was at 10 o'clock. Okay, are you ready? Here we go. I'm going to park the car on the north side of the building. So we're now inside. That behind the desk right there is Trevor. We're sitting on a bench in the back just waiting. And wait for it, that's the dreaded back door. They just gave Cora an injection that has made her a little nauseous. Poor baby. We've gone through the door. She's on the table. You can tell she's a little nervous. Ears back, panting. That shows she's a little anxious. That's the doctor. He's reassuring her while they get things ready. Okay, they've given her an anesthesia, so she is sound asleep. She has a tube in her throat. That's to help her breathe. I assure you, she feels nothing. She's not in any pain at all, and Mommy's there. During the entire procedure, they keep a close eye on the monitor, which shows her heart rate and her breathing. Don't let the half-closed eye freak you out. That's the way she sleeps at home, too. It's freaky. You hear the noise of the drill, just like at a dentist office. It looks like there's a lot of blood there, but ultimately she had to have 10 teeth pulled. We're all done. She's wrapped in a towel. She's going to be waking up. Forever waking up. There her is. Hey, Cora. Her mouth is numb. She's not sure what to do with her tongue. They're putting her in here to wake up some more. They're so gentle with her. They're going to put hot water bottles in there. There we go. And cover her up real good so she stays nice and warm, and she'll continue to wake up. So it's a few hours later. Cora is awake and ready to go home. You want to say hi, Cora? Let them see that you're fine. Say, I'm okay. Looky. Yeah, say, I'm okay. I'm awake. And I'm okay. Yeah. You ready to go home? So ready to go home. You're so ready to go home. You can hear her whining just a little bit, but she's had lots of pain meds, so I think she's just a little confused still. The first thing she wanted to do when we got home was go outside, so you can see she's fine. And yes, our backyard looks terrible. We have lots of work to do. That evening at dinner time,
Hey, Cora.
she ate just as ferociously as she always does. Before I go, there's a couple of things I want to mention. I hope you got some benefit from this video, and if you did, please don't forget to like, because it helps support this channel. And if you haven't yet, be sure and subscribe, ring the bell so you'll be notified of future videos. But one thing I want to mention is that 2 days before Cora had her dentals, she went in to see the doctor. She was thoroughly checked over. She was given antibiotic and pain pills ahead of time. And the night before we went in for the dental appointment, I started her on her antibiotics. So I highly recommend that if you have yours your Chihuahua's dental appointment, that you do that first. I also want to point out that most of you know Cora is a rescue. She was 6 when I got her. She didn't have a really good life before, I don't believe. Her teeth were never taken care of, and I'm positive she never went in for a dental cleaning, professional dental cleaning. So as a result, I think I mentioned in the video, she had to have 10 teeth pulled. But she was able to keep her canine teeth, which help hold in her tongue so she doesn't constantly hold her tongue out like my little Winston does. It's very cute, but I prefer to avoid that if at all possible. My last piece of advice on this subject is don't forget to take your Chihuahua in to be seen by your vet and checked annually at least. Get to know your veterinarian, get to know the staff there, because the more you know them, the more you will trust them when they take your Chihuahua to the back. Remember too that most veterinarians have pets of their own. They're very understanding. Talk to them about your fears or your worries or your concerns, and they can alleviate some of your fears. Remember too that most of them have pets. I said that most of them have pets of their own, but they also went into the profession in the first place because they love animals. So remember that too. And very, very, very last of all, I want to thank El Paso Animal Hospital so much for everything and for allowing us to do this. If you're watching, I love you all. Thank you to the doctors. Thank you to the staff. A special thank you to Dr. Herod and to Tiffany. Tiffany was the vet tech who helped take care of Cora during her procedure, and she did a wonderful job. So thank you all, and until next time, have a wonderful day. Good, bad, or ugly, that's a wrap.